the cause of why we compare so poorly with other countries. So our surgical resection rates are pretty comparable actually, but only a fifth of our patients got radical radiotherapy, and that's in England, and that compares to about 50% in other countries. And I think that's where we need to focus on the provision of more accessible radical radiotherapy. Now, the reason why we're not matching up to other countries is probably complex, and it's got lots of reasons. One reason might be that in this stage it depends on ready access to lots of diagnostics and different types of treatment. And we know from other work that the National Lung Cancer Audit has done that there's deficiencies in access and timely access to this treatment. We know that in lung cancer, patients decline more rapidly in terms of their performance status. And so timely access is absolutely key. And we know that that does correspond to patient outcomes, and that's from previous work that we've done that show that that trusts that don't have ready access to diagnostics and treatment modalities, or don't have adequate staffing provision as accordance with the National Commissioning Guidance, which was published in 2017. According to that trusts that don't adhere as closely to that, their patients are less likely to survive to 1 year, less likely to receive timely treatment, and less likely to receive active treatment. So clearly access to these important resources is a deficiency in England. But I think it goes beyond that. I think access to modern radiotherapy techniques, and also our preconceptions about patients. Thinking that these patients may be increasing our boundaries about what we think patients can tolerate in terms of treatment. And patients can tolerate more treatments now with the advent of more modern radiotherapy techniques. And I think in lung cancer there's a sense of feeling of nihilism that these patients can't accept these treatments, but we need to go beyond that now to change things. And that's particularly with the advent of durvalumab. So we found that from our data that actually only 4% of people would have benefit from durvalumab because they would have been eligible for it, because they would have completed chemoradiotherapy. And so if we don't address these gaps, then I don't think we will meet the same kind of survival patterns as our international peers.